Hello and welcome to Medical Dialogues. I am Dr. Garima Soni. Let's look at today's top medical news. Study finds calorie restriction and therapy together transform gut microbiome, enhance mental health in women. In a recent study published in the journal Nutrients, researchers investigate the combined effect of calorie restriction and clinical psychological intervention on the composition of the gut microbiome and stress-related mental health outcomes in women. Common mental and metabolic disorders such as obesity, depression, and diabetes often share overlapping biological and lifestyle factors, leading to their frequent co-occurrence and higher rates of morbidity and mortality. While pharmacological treatments are available to manage these conditions, maintaining adherence is difficult. Side effects such as weight gain can further reduce patient compliance, increasing the likelihood of negative health outcomes. Lifestyle interventions include diet and stress reduction have become increasingly popular for their potential benefits. The gut microbiome influenced by diet and stress plays a crucial role in mental and physical health. Can eating meat regularly increase your risk of colorectal cancer? Study finds. In the recent study published in the journal Nutrients, researchers investigated the association between red and processed meat consumption and the subsequent risk of colorectal neoplasms. This significant research contributes to the limited body of evidence by focusing on the joint effects of meat consumption and genetic predisposition on the disease risk. Screening colonoscopy data from 7,291 participants and genotyping information from a subset of 4,774 participants were used for the study. Study findings revealed that while red meats were not significantly linked to increased risk of colorectal neoplasms, processed meats substantially raised the risk. Specifically, consuming processed meats more than once a week was associated with a 19 percentile increase in polygenic risk score for colorectal neoplasms. This highlights the importance of limiting processed meat intake as a key health behavior that could help mitigate genetic predisposition to colorectal cancer. Study finds common lab tests are not reliable for diagnosing long COVID. The study published in Annals of Internal Medicine found no reliable biomarker among 25 routine clinical laboratory values for prior infection, PASC or specific type of PASC clusters. This suggests none of these routine labs can serve as a clinical useful biomarker of PASC. Study shows patient can have severe long COVID with normal lab results. This suggests doctors should not focus on the results of blood panels to diagnose long COVID but should focus more on symptoms and ways to present patients get relief by treating their symptoms. This study was funded by National Institute of Health researching COVID to enhance recovery initiative. The Recover initiative includes multiple research studies that involve thousands of participants from across the country. In Colorado, these studies take place in Colorado Clinical and Translational Sciences Institute at CU and Schutz. Lack of purpose in personal growth may precede mild cognitive impairment, study finds. Recent research published in the Journal of Neurology, Neurosurgery and Psychiatry suggests that a perceived lack of purpose in life and limited opportunities for personal growth in older age might precede the onset of mild cognitive impairment, a common precursor to dementia. This decline in psychological well-being typically occurs 2 to 6 years before MCI is diagnosed, even if no obvious symptoms are present, and regardless of whether MCI progresses to dementia. While previous studies have often concentrated on a sense of purpose, this research broadens the focus to include other aspects of psychological well-being such as self-acceptance, autonomy, effective management of one's environment, meaningful connection with others, and personal growth. To bolster the evidence on this link, the researchers examined changes in psychological well-being before and after MCI and dementia diagnosis among 910 cognitively healthy older adults from the Rush Memory and Aging Project. This ongoing long-term study began in 1997 includes participants from a variety of settings in northeastern Illinois such as senior and subsidized housing, continuous care retirement communities, social service agencies, church groups and private homes. That's all for now. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.